speaking to patients who have dealt with medical trauma in their time, right? One, it's not your fault. It can be made to feel like your fault sometimes. I know medical gaslighting is very real. I think providers aren't trained very well to deal with highly emotional situations, the idea of uncertainty. And so I just want to make sure that you understand, it's not your fault.
Welcome to the Medical Trauma Support Podcast, where we come together to bring more humanity into healthcare. I'm your host, Sarah Stasica. Hello, everyone, and welcome back to the Medical Trauma Support Podcast. I'm really excited about my conversation today with Alec Bradbury. Alec is a family nurse practitioner, and I am going to let you go into a lot more detail on that, Alec. But first, I want to tell people how I found you. So,
Okay.
Alec's posts on Instagram have really caught my attention because, Alec, you show up in this really compassionate way, and you very clearly are engaging with patients and people as humans. And I think that's so beautiful. So I just wanted to tell people to find you on Instagram
Thank you.
and TikTok.
Thank you. I
Uh,
appreciate it.
Yeah, but I was hoping that you could tell the audience more about yourself and the work that you do.
Yeah. So, as you mentioned, I'm a family nurse practitioner. I work in primary care in Southern California, where I actually do street medicine. So, 100% of the patients that I serve are unhoused. And so we go out into the streets and we meet them where they are. We go out with case managers and a therapist, and we try to really get them into housing because, without housing, without safety, without a sense of safety, as I'm sure you're aware and your listeners are aware, it's kind of hard to heal, right?
Yeah.
So that's a little bit about what I do in my day job. But I really, as I as I came into the field and I
Mhm.
was seeing more and more patients, and I just kind of realized that there was a big disconnect between the medical community and the patients and meeting them where they are and meeting their needs.
Uh-huh.
And so as I was treating more and more patients, especially my ones with chronic pain, chronic illness, I was just realizing they were not really getting a whole lot better. And I felt pretty inadequate in my care and my training to service these patients. And they were feeling similarly about a lot of their providers, right? And
Yeah.
so I started to do a deep dive into these spaces, came across a whole bunch of wonderful information I just wanted to share with everybody. But then I quickly realized as I got onto these platforms, Instagram, TikTok, that, what I was seeing in clinic in terms of this disconnect between patients and providers was
Uh-huh.
even worse than I thought, right? And so I had people in my comments, talking about how their providers don't hear them, how they're saying their pain isn't real, and worse than I had really ever thought, right? So
Yeah.
quickly, my message was like, okay, I have a message to get out here, but at the same time, there's so much healing that needs to be done in
Yeah.
bridging this gap of communication between patients and providers. And
Yes.
so I tell my students, I've, students, NP students, PA students rotate through with me pretty regularly. And, when you're going through school, we got to worry about knowing this disease and this medication and how to treat this. And we're so worried about our boards and, studying for all of these very factual questions and answers, right?
Yeah.
But what I tell them is that's all good and fun. You should know that stuff, right? And that's important. But you could be the smartest provider in the world. You could know all of these things. But if you don't know how to make the patient feel heard, if you don't know
Right.
how to make them feel understood, you don't know how to bridge this communication gap, then they're not going to want to hear you. Right.
Yeah.
And you're not going to have that trust to where they're going to go along with this plan that you guys have developed together.
Yeah.
And so bridging this gap, making the patient feel understood, showing empathy, meeting them where they are and collaborating with them has really become kind of the cornerstone of my message, even more so than, the ins and outs of chronic pain and chronic illness, which is still all fun. But yeah, that's
Yeah.
kind of what led me to create the posts that I've created that you happen to
Yeah.
stumble upon and that I'm grateful that you stumbled upon. Yeah.
Yes. Well, just everything you've said and what I've obviously seen from your posts is like you are showing up as a human and
Right.
seeing the other person that you're with as human. And like you said, like bridging that gap and the safety that can come across to the person that you are engaging with is so important for medical care and
Mhm.
again, like for us to show up with other humans and to be able to feel safe. And I actually, just before, us sitting here together, I was just in a workshop where we were talking about clinician regulation and how a regulated clinician is better able to co-regulate with a patient. So you have a patient who comes in who may be in sympathetic charge, may be shut down, and you have the power as a clinician to help soothe them. Not
Mhm.
always. It's not
Mhm.
perfect. It should not be put on the clinician. I want to get really clear about that. But a clinician who's regulated and able to co-regulate with a patient, there's going to be just like such a better outcome for both people.
Mhm.
Like your engagement with the patient's going to be safer. It's going to be better. And not that I planned for us to go into a conversation about this, but there is violence in medical workplaces. That's an issue. And so to understand kind of what is going on in the nervous system and when somebody's neuroception says, whoa, this is danger, some people are going to go into fight. And that's
Mhm.
when it is dangerous for the clinician. But let
Mhm.
me let me kind of like back up there. That I went pretty far onto a tangent, but I'm curious about, first of all, how did you learn this? Like, is this something that you learned in your training, or is this like focus on compassion and nervous system something that you learned kind of on your own?
Yeah, it's a little bit of both. I Communication is a skill. I think
Mhm,
even empathy, while it is natural to many of us in certain circumstances, right?
mhm,
Even that can be a skill, at least applying that in certain situations. And so everything has been learned to a certain degree, but I would say that, one, my parents did a great job instilling this in me, right?
mhm,
And then growing up, I initially actually started in the physical therapy field. That's what kind of
mhm,
called me to the health field. Um, and I felt there where I'm working as a physical therapy aide, right? I'm not laying hands on anybody, but my job is to really work one on one with the patient, sometimes for a half an hour, taking them through exercises. We're talking. And I
yeah,
just really fell in love with that aspect of that. And that's kind of what drew me to health. So I don't know exactly where it all started. um, I've always considered myself a decent listener. Maybe my fiance would disagree at times, but um, but as I aged, yeah, I felt like the more that I worked with patients through physical therapy and then through the nursing program, and then I just loved the nursing model in general. It's very holistic, right? The
mhm,
nurses were just named the most trusted profession for whatever year in a row now, or in the double figures, somewhere up there.
yeah,
Um, I felt like the program did a very good job of instilling in me just that compassion and that empathy that we need to have, that bedside manner, right? And
yeah,
how that has kind of carried into my practice as a nurse practitioner. And then
mhm,
just personal development stuff on the side, reading and just kind of becoming obsessed with human psychology and our connection
mhm,
and our ability to communicate. Because like I said, with that, real magic can happen between two people or
yes,
between in a group of people, but without it, you're fighting a very, very uphill battle. And I think that just rings very true for this, especially in the medical space, right? Where we're just someone's coming in and they're down bad or they're hurting or they've experienced all this medical trauma from
yeah,
previous providers and now they're coming into your office. And so not only do you have to address the symptoms at play, but you have to address their current emotional state and the trauma that they've experienced, right?
mhm,
And like you said, we got a 15-minute appointment, right? Or maybe a 30-minute appointment if we're lucky. How do we address all of these things in one go? But as you
yeah,
said, the communication, the presence, the hey, I'm here for you, I'm working with you. I'm so
yeah,
sorry that you've been through all of that. I'm proud of you for coming in today, can
yeah,
really help, within a few seconds, be like, okay, I'm in a safe space, right? I can feel safer at the very least. And now we can proceed because if we're on edge and we're thinking about, this, that, and the other, and we're feeling unsafe, it's going to be really hard for them to communicate with me what's really going on. And then things are going to be slipping from their memory, and we're not going to be able to kind
right,
of get to what they really actually want to talk about. And so,
yeah,
I could go on on a huge tangent about all the ways that it impacts care.
yeah.
Um, but yeah, it's just so important, and recognizing that importance, I think, has just led me to want to know more and be the best that I can be.
Yeah. Well, I think that's so beautiful that you called it magic because I really agree with you. I do think when two humans can like deeply connect and feel safe with each other, magic happens. But the
Mhm,
other thing that I wanted to say, and when you said this, I just like felt it in my heart when you talked about saying to somebody, I'm proud of you for coming in today.
mhm,
Oh my gosh. I
mhm,
I have talked to so many people, and I have myself experienced medical trauma, and, I've talked to so many people in the peer groups that I run, and I just think if they had heard somebody say to them, "I'm so proud of you for coming in today. I know how hard this was for you with the history that you've had of medical trauma." Oh my gosh. So it's like what's happening is you're not only making them feel safe in this moment, but you're also offering a little experience of healing from some of the traumas that they've had in the past because while some of the traumas we really can't control. I mean, when somebody has a cardiac event, when there is a really big life-threatening emergency, that's going to feel surprising and overwhelming to somebody's nervous system, right? But there are a lot of situations that people have shared with me, people's stories where it wasn't actually that big emergency type of event that caused the trauma. It was not having connection. It was being dismissed or invalidated or not listened to when they were in this really scary place. And so, you've probably heard like people can get harmed in relationship and we also heal in relationship. So I'm just thinking about how beautiful it is for the person who shows up and hears from their medical provider. I'm so proud of you for coming in today.
mhm. Absolutely. It's huge too because oftentimes when we're our own biggest critics, right?
Yeah.
I can speak to that for myself with confidence, right? And it's so easy to nitpick all the things that we do wrong throughout the day and all the things that we should be doing better. And as providers, somebody comes in and we're fixers, right? We got to fix this. What's
Yeah.
wrong today? List all the things that's going on, and then let me tell you the things that you are not doing and that you should be doing, right? But what we're not taught very well is to reinforce the things that they're doing well and to help
Yeah.
point that out for them, point
Mhm.
that out to them. Because as I say, I bet the patient is harder on themselves than the provider is on the patient, right? And so when we can point out even the little things that they're doing right,
Mhm.
the more our brains and our nervous system starts to pick up on those things, right?
Mhm.
And it starts small, but it might just be like, like I had a patient the other day come in, he had relapsed, he was back on the street, doing so well, he was drinking again, and we saw him on the van, and he told me the whole story, talking about the grief that he had that was kind of led to all of this. And instead of just being like, all right, well, let's get you into the detox center, right? I
Yeah.
said, "Hey, well, I'm proud of you for being here today."
Yeah.
Because that's no matter what you have, if the patient is in front of you and they have made it to the office, they are talking with you, they have made an effort in their care, right?
Yeah.
And so there's always something, or, "Hey, thank you for being honest with me," right?
Wow.
And so now the patient can start to pick up on these little things, these little wins. Hey, I
Mhm.
made it to the doctor's office today. That might not feel like a win because all we're thinking about the whole time is, okay, I got to say A, B, C, and D, and I got to make sure it's efficient. I got to present a certain way, and I can't present as too sick because then, they'll think I'm exaggerating. I can't present as too well, or else they're going to, not believe what I'm telling them in terms of so you have 1,000 different things you're trying to manage at the same time. But
Yeah.
oftentimes we're not thinking, hey, but I'm making it to the appointment today. I'm proud of me for doing that. Maybe that
Yeah.
comes later as sort of a self-soothe, but I think we're just missing so many easy little points of connection that it's not fluff. It's part of the treatment and it just takes a few seconds. It doesn't take all that long to do, right? So
Yes.
just simple little things like that, I think can go a long way.
Yes, and I think that's so powerful because that is something else that we talked about in the workshop is for a provider who is doing some of the absolute hardest work out there, like the work you're doing is intense. It's like somebody is coming to you with their life and their emotion and there's so much to it, and it can feel like, "Okay, and I'm working in this system that isn't really taking care of me,
Mhm,
right? And I have 15 minutes with each patient, And after work, I've got to go home and I've got to pick my kid up from school and I've got to take them to dance, and, all the things and make dinner. So it can feel really overwhelming when somebody's like, oh, hey, provider, you need to better communicate with your patients. So
Mm,
to be able to, first of all, validate how hard it is already, the work, and how important and amazing and magical this work is that you're doing every day for people. But to say, and guess what? There are these little shifts you can make that aren't going to take extra time, but these little shifts are actually going to help you as the clinician better connect with patients. And then it becomes this better experience with a patient so that ideally, and this isn't always going to happen, but ideally there can actually be some fulfillment from that interaction. That interaction's going to feel better. So I just
mhm,
think it's really beautiful that you're talking about these like little ways of connecting. And it does make me think about some of the other amazing clinicians that I've talked to on this podcast. And one of them, he shared about one of his mentors would carry this foldable chair around with her on rounds. And she'd fold her chair and she'd sit down and she would be eye level with the patient in the bed and she would have the conversation that way.
mm,
That didn't really take any extra time. Maybe the seconds it took to unfold the chair, but that experience between those two humans, a clinician and the patient, is going to be really different
mm,
because of that little shift in where they place their body. They were aware of that. And so instead of standing over the person in the bed, you're sitting down, you're saying, I'm making time for you. You're important. And I'm also on like, our eyes are in the same, on the same level. And that stuff sounds so little, but it makes such a big difference.
100%. I mean, there are so many different things that we can do too, right? I recently posted a video about even just taking a breath before going into the appointment, right? We're talking about nervous system regulation, and that's super important for the providers too, right? You
Yeah.
you touched on all the things that providers have to do throughout the day. The last thing I want to do is give another to-do list item. Okay, this is
Right.
something I have to do. I have to say more words and do more things, and it's going to take more time. But if we can find ways to just, hey, if we actually just before we go into the room, take a deep breath, right? Slow down, be present for a second. Because, like you said, providers have, they have all these things piling up on their plate and then in their personal life. And maybe their kid is sick at school and they have to figure out how they're going to go get them. But they're still at work and they have to tend to this patient. And then
Mhm.
burnout is a real thing. This kind of like empathy burnout too. And when you're trying to be, empathetic for 8 hours a day, whatever, it can be a lot. But just working in these little things of just, "Hey, I'm gonna take a deep breath before I go into the appointment." It's
Ugh,
giving
yeah.
too, it's giving energy back, right?
Yeah.
And so what we can do and something that I like to do too is, like, take a deep breath when you're maybe putting on the hand sanitizer before you go into the room, and if you can really just visualize what I like to do is visualize the patient. Like,
Uh-huh.
I'm in the patient's body, I'm sitting on the exam table, I'm looking at the
Mhm.
door with all of
Yeah.
my concerns, just hoping somebody can help me out for the next 10 to 15 minutes. And I'm
Yeah.
trying to prime myself for empathy before I go in the room. And all
Mhm.
that takes is, what, 5 to 7 seconds of just a deep breath in and out, and then I go in, right? And so there are all these little things that you can do. The chair, like you said, communication isn't all about words and saying more words. But
Mhm.
body language. Is there a way that I can position my
Yes.
body? Can I make eye contact and look up from my laptop, while I'm charting? That helps the patient feel like I'm connecting a little bit more. These simple things, and what we don't really realize is we're doing this for the patient. We're always taught about, okay, doing it for the patient, but we don't realize is that it gives back to us. When I
Mhm.
say, "I'm proud of you for coming in today," I feel better. The
Mhm.
patient might smile a little bit. That gives back to me too. And so instead of viewing it as these things that we like need to do and it's another chore, you can think of it as something that actually takes something off your plate. It gives you more energy. It helps you to get
Yeah.
through the day better and more
Yeah.
clearly. And I think honestly, it just primes us to be a better person even outside of the clinic because the habits that we establish in the clinic don't just die when 5 o'clock hits and you step out of it. Right,
Yeah.
helps carry you on as that person even at home. So,
Yeah.
yeah, just so many important little nuggets we could go off on here.
Oh my gosh, I know. It's so beautiful. I love that so much. And one of the things that I was thinking about as you were talking is how are you caring for yourself? And how is this system you're working in caring for you? Because I think both are really important to be at the point where you have that like emotional capacity to all right, I'm consciously taking the breath, I'm getting present, I'm putting myself in the place of the patient. Because when we do talk about kind of like that true burnout and compassion fatigue, even that is going to feel impossible, right? Another
Mm,
person that I had on my podcast, Dr. Laura Votter, talked about research that shows a physiological depletion of empathy when you haven't gotten enough sleep.
mhm.
And so I'm curious what you're doing and how your system that you're working in is supporting you to even make that possible.
Yeah, it's a great question, and it's gonna vary from person to person. I think it all starts with the foundation of, like you said, getting 8 hours of sleep or as much as I can, making sure I'm having a good kind of anti-inflammatory diet that keeps me nice
Mm,
and sharp in the morning. I'm hydrating, I'm working out, or I'm exercising in some form or fashion
yeah.
each day. Every morning, I do kind of a 15-minute priming. It's almost like a guided meditation exercise that incorporates some sort of activating breath work, gratitude,
Mm,
as well as visualization kind of the future. And then
yeah.
before I go into work, I make sure that I ground myself in my values. I have my values kind of listed out and then why each of those are so important to me. And I find
Yeah.
that if I can live by my values, right, rather than my to-do list, then I'm able to be much more present and then much more happy with the outcome. If I can get through the day, if I can in with myself during the day and say, okay, have I been my authentic self today? Have I been present? Have I been able to be, you know, energized, maybe a little silly, maybe a little bit creative and show a little bit of love? And I'm like, check, 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 check. That gives me a little bit of energy too. Like, okay, maybe I didn't get to these to-do list items, or maybe I'm going to be getting home a little bit late today, or whatever it might be. Maybe I'm not feeling my best self, but I think grounding myself just in the fundamentals of what gives me energy just physiologically, and then
Yeah.
grounding myself in my values, is really important for just tapping into my internal source of energy, because it's so easy to try to reach for that. And I do this from time to time, reach for that Diet Coke, at lunchtime, or reach for, that cup of coffee, whatever it might be. Um, but, that plus a little bit of breath work, nervous system regulation, anywhere that
Yeah.
I can put that in, I think is really important. And of course, taking time to do things that you love and connect with others,
Yeah.
either in the evening or on the weekend, whatever that might be, is
Yeah.
is critical. Yeah.
I love that, and I love that you talked about being a little bit silly, fitting in a little bit of that silliness, and I
Mhm.
feel like multiple things that you've talked about in the last few minutes make me think about, again, the nervous system and using the polyvagal theory framework, talking about ventral vagal.
Mhm.
And things that get you into that space, and ventral vagal is, for people listening, is basically safety and connection, right? That's when we get into the space in our autonomic nervous system of feeling connected with others and safe. And when you talked about telling somebody, "Hey, I'm proud of you for showing up today," and you talked about getting that little smile back from them, those little pieces of social connection help keep us or get us into that space of safety and connection. And being silly and laughing with people is another beautiful way to get ourselves to that place. So I love that so
Mhm.
much. And I'm so moved by what you shared and like what you're doing each day to get yourself in the space to show up and do the work that you're doing every day.
Mhm, and it's definitely not some days are harder than others, right?
Of
And I'm
course.
definitely not perfect with all of this. I don't wanna just
Yeah.
make it seem like I'm a ray of sunshine and everywhere
Mhm.
I go, as much as I'd like to believe that. I
Mhm.
know that that's not true. But,
Yeah.
yeah, there's and it's something that I've had to really work on, right, and build these new habits. Um, but yeah, like you said, that social connection is just so important, and during the day, it can just feel like this slog, and I feel like if I can just be silly, make a joke, maybe even, and I actually never told anybody I do this, but sometimes I'm in the bathroom and that's just, a moment for yourself, right?
Yeah.
And sometimes I'll just hit a little dance move, and it just cracks me up a little bit. I'm like, this
Yeah.
is so ridiculous right now. I'm just in the bathroom and I just hit the whoa or the Dougie, whatever it might be, right?
Yeah.
And it just makes me smile. It just cracks myself up and
Nice.
gives me a little bit of energy. And,
Yeah.
it can feel so heavy, with the the
Yes.
trauma, the empathy, the getting behind, the to-do list, the what's going on in your personal life. And I think when I can infuse a little bit of silliness, and this might not be for everybody, right? This is where we kind of
Yeah.
have to tap in what are our own values, what gives me joy when I'm at my best, what is happening in my life and how am I feeling, what
Yeah.
am I prioritizing? And I just kind of came to the conclusion that a little bit of silliness goes a long way, right?
Yeah.
And so that's what works for me. And so I try to roll with that as much as I can.
Yes, and, like, also the dancing, and I'm thinking about, oh my gosh, like, just even if you're having a hard day and you see one of your coworkers and you do a silly little dance move with them and
Mhm,
back, or if there's time to go, you have a 5-minute break, go in your car, put on your favorite song and, like, jam out a little bit, or go into your office if that's a possibility, put on a song you love, move your body, right? Because, you know, to go back to the nervous system, when we're starting to feel that activation and we're feeling like we're getting into that sympathetic charge, that is our body giving us that energy to move. We're supposed to mobilize, right? And
mhm,
so if it starts to feel like it's too much and we can't settle into ourselves to connect, go move your body. Go for a quick lap around the building. Go dance it out a little bit if you can, because that movement is literally what our nervous system is sending us because it thinks we need to mobilize to fight or flight. So
mhm,
to fight or run away. So it's like, how can we work with our bodies so that we can get into that space that you talked about of being able to ground yourself, right? Because we
mhm,
all know as humans that when we're really up regulate, like we're really mobilized, it can be really hard to ground and connect.
mhm.
Yeah, so finding
So
moving some of that out.
100%. And
Mhm.
I love the idea that, we all want to feel a certain way, right? And sometimes our emotions are down and we try to like think our way out of it and rationalize it. And well, maybe I can be grateful for this. And we just kind of fight our mind with our mind. But I love this idea that emotion follows motion. Right?
Yeah.
And so the way that we carry ourselves, the way that we stand, right?
Mhm.
We probably all heard that like, oh, if you just kind of smile, you feel happier naturally. Well, it's like,
Right.
well, yeah, your brain associates the smile with happiness. And I know
Mhm.
it's like, okay, we feel the emotion, we smile, but we can kind of turn it on itself, right?
Yeah.
It's kind of interesting power of the nervous system. And so
Mhm.
sometimes we might not feel very good and we try to think our way out of it. We might not feel like dancing. We might not feel like doing breath work. We might not feel like going for a walk. But if we can understand that, hey, from motion follows emotion. And,
Mhm.
again, this has its limitations. I'm not just saying, oh, you hit a dance move and you're just going to be happy for the rest of the
Right.
day, right? We're going through some really difficult times. But the way that
Mhm.
we carry ourselves, the more that we can kind of influence our body posture, our breath work, the
Yeah.
more that we can just be like, hey, I don't feel like dancing, but I'm just gonna throw on this song and I'm just gonna do it a little bit, maybe singing a
Mhm.
little bit, just
Yes.
whatever in the mirror. From that motion follows emotion. And I
Yeah.
think it's really easy to get trapped in our own heads and trying to think our way out of it and reason it or rationalize why we should be feeling a certain way. But sometimes it just starts with the body and,
Yes.
and kind of
Yeah.
helping ourselves. Yeah.
I love that. And then, something you said about we're in a hard place right now, right? So I think
Mhm.
also acknowledging that we're in a hard place like in our country and the world, but that on top of everything else we have in our own bodies and our own communities, and like just to acknowledge right now that it's hard.
Mhm.
It's
Mhm.
hard because we can both talk about things that we can do to feel better. I think it is really important, like you did, is to validate like we're in hard times. And
Mhm.
it also makes me think about the work that you're doing with street medicine.
Mhm.
And you must be seeing people that are really impacted, maybe people who are unhoused who've never been unhoused before. So I'm curious if you'll tell us a little bit more about what it's like to do street medicine. What does that look like? What's
Yeah. Yeah. And I loved what you said initially too. And so it made me think of something, right? Is just because we feel a certain way doesn't mean we should try to suppress it or
mm,
ignore it, necessarily divert away from it, right? It's important to feel these emotions because I am a true believer. And if we try to suppress an emotion like guilt, anger, or fear, that is going to manifest in other ways,
yeah.
right? Physiologically, mental health wise or behaviorally, it will manifest in other ways. So I'm not saying, hey, just like if you're feeling super angry about something, just like shove it down, hit a dance move, and try to be happy and move on. Like it's
Right.
still important to feel those emotions as well and
Yeah.
process those. So I do want to mention that, and I appreciate you bringing that up.
Yeah.
But yeah, as it pertains to street medicine and some of the work that we're doing there, it can be difficult work for
Yeah.
sure. We experience a lot of, we work for months, sometimes over a year to get a patient to a certain point, and it feels like we've kind of done this, and now we get them up to here, and then all of a sudden, they're back on the
Mhm.
street. They're in their ways, just like they were on day one, and it can be kind of
Yeah.
soul crushing, especially like we talked about with being empathetic is
Yeah.
that requires you to kind of be on the emotional level of the person, right? And to really care for them. We really care for these individuals and what their outcomes are, their well-being. And it can be really difficult. And being in street medicine, I'd say that the lines are blurred a little bit more too in terms of how far do I go for this individual? Because when you're in the clinic, you're in a brick and mortar, someone is coming to you. If they no show, they no show. You can try giving them a call. That's about all you can do. But in street medicine, you're trying to go to this individual. They might not have a phone. They might
Mhm.
be in the hospital. They might be in jail. So now you're out looking for them
Yeah.
sometimes, right? And we're meeting them where they are. And so it becomes even more intertwined as to like, sometimes like, okay, well, when do we maybe just kind of call it for the day and then head back versus drive around and continue to look for this person? And it's really rewarding work when we see this progress, but
Yeah.
it also yields a lot of it teaches a lot of patience too. Because
Yeah.
again, meeting someone where they are, maybe they're not ready to get off the street. My idea as a provider, everything that I know about, oh, we want to get into housing, we want to be, safe, meet our Maslow's hierarchy of needs, right? That this kind of foundation, and for some of these patients, it's, hey, my community is on the street. I don't
Right.
want to go into a house because now, or an apartment because now I'm isolated. I've had patients come to me after getting housed and being like, I'm depressed. I'm actually only there once a month because my community where I've been for the last 25 years is out here on the street. And
Yeah.
this is where, it's meeting that need of emotional safety, right?
Yeah.
Versus when you're in an apartment, you're isolated. It's like, well, what do I have here? So we have to really check ourselves and what we feel the patient needs and what we think would be best for them
Mhm.
and balance that with what they feel is best for themselves and their goals. So that's why I'm always
Yeah.
asking at the beginning of the appointment, what are your goals? What do you value? Where do you see yourself in a couple of years? Because if I don't know where you want to go and what your goals are, and I just kind of stick to what I've learned in school and what I think it would be best for you,
Yeah.
then we might be operating on 2 different planes, never actually getting to where we wanna go, right?
Yeah.
So, man, there's a lot of things that I could say about
Oh my gosh, yeah.
medicine, but it's great work, it's rewarding, it's difficult at times, but I just love that I get to connect with these beautiful humans that are out here that we oftentimes will, circumvent or skip. They have a lot of
Yeah.
there's a lot more wisdom than I think we understand in some
Yes.
of these people, yeah.
Yeah. I mean, I have so many questions when you said that. I'm like, so many questions. I feel like, this could be like a 10-hour conversation. So
Mhm.
I'm trying to like keep keep my focus because I just really love everything that you're doing and what you're talking about and the importance of it makes me think also about the shared decision making, self-determination, acknowledging that somebody is the expert on
Mhm,
themselves and their life, and anybody who walks in to see you has an entire lifetime of a history that's following them in
mhm,
that they know that you don't know. And so being able to show up at the table together and saying like, you're bringing everything, you're bringing your education and your experience, all of that training that's so important, and your compassion, but also you don't know
mm,
what this
mhm,
person's history has been, right? And so when you can come together and really truly share decision making for somebody's medical plan, right? Their treatment plan, that's where magic happens.
100%, and I posted a video about this the other day too, is the patient really is the expert in their own experience, and us as providers, I think we have a duty to respect that, and
Yeah.
we would be smart to respect that as well, because if we're just trying to make a decision unilaterally without the patient's input really, and without understanding their expertise in their own body, then
Mhm.
we're operating without a significant source of information here.
Yeah.
And again, what we feel would be best for the patient, they might not feel the same way.
Right.
They might know that it's not that way, but we might try to just continue to force this thing down because, the algorithm or whatever this population-based study told us to do, which maybe has only worked for 40% of the population, right?
Yeah.
We might try to fit them in this bucket and say, "Oh, well, this is where the algorithm told me to go," right?
Yeah.
And what we forget sometimes, and I love this line, it's often attributed to Sir William Osler in the late 1800s, but what he said was, "It's much more important to know what kind of patient has a disease than what kind of a disease a patient has." And I
Mhm.
think that that gets lost in medicine quite often, especially with the short appointment times and this idea that we are the expert and we should know everything. And so, oh, if I ask what the patient's preferences are, oh, this now I've opened a whole can of worms and it's just going to take too long. And so the system has its constraints for
Yeah.
sure. And
Yes.
it's a real problem. But at the same time, we're just kind of kicking the can down the road and losing
Yeah.
time in the long run
Yeah.
if we're not coming to that understanding earlier, because now we're just gonna put them on a 3-month course of this and then come back in a few months, "Oh, it didn't work, okay, and then this," and then,
Or they
now
didn't
we're back
take
to
it,
or they
right?
didn't take it at all,
Or they
yeah.
didn't take it because it kind of also makes me think about parenting and, like, if you wa they say if you want your kids to eat vegetables, grow some vegetables in the garden, have them cut up the vegetables, and they're way more likely because
Mhm,
they've been a part of the
mhm,
creation of
mhm.
that it doesn't always work for me and my kids, I will tell you, because 'cause I've tried, but it just when somebody is a part of the decision making for their bodies, right, and their lives, then it's going to be something that they're interested in doing, right? You're gonna get a lot more of patient buy-in
Mhm.
if it's shared decision making. So,
Amen.
it's saving a lot of time too.
Yeah, you just hit the nail on the head. This is the big thing, and I think if you're familiar with, like, motivational interviewing in
Mhm.
medicine nowadays, right, is it's so I mean, that's just like at the crux of it, right?
Yeah.
Is we want to help the patient feel understood, but help them come to these conclusions themselves. I mean,
Yes.
how often do you think it works when a doctor says you need to stop smoking?
Right.
Or, do we
Like
think
it's
that's
that easy
effective? Do,
too.
do we
Right.
think that's effective? Like,
Yeah.
it's just not, and they might actually be like, "Well, I'm going to keep smoking because this doctor told me I shouldn't smoke." I mean, it's
Yeah.
this classic, anyways, but that's kind of the old way of doing things. But with motivational interviewing and what we're talking about here, if you can actually dive in, it takes a little bit more time up front. Again, it's easier to say stop smoking, documented, counseled patient on smoking cessation, right? To cover ourselves
Right.
legally. But in
Yeah.
reality, we're not making any change. And so to push that up front and to actually evaluate a little bit more about like, okay, what's behind this? How do you feel about
Mm.
smoking? Is today really even the time to try to stop, right?
Yeah. Yeah.
Because sometimes you just ask about it. They say, "Okay, doc, I'm not ready," and you just tell them, "Okay, sounds like you're not ready today. Would you mind if we talked about it at a future appointment?" And
Yes.
they'll say yes, and sometimes they'll come back and be like, they'll leave and they'll be like, "Whoa, this doctor didn't or this provider didn't try to counsel me on smoking cessation," and they'll think about their own habits a little bit, right?
Yeah.
But like you said, at the core of any kind of behavior change, the human in front of us, the person kind of needs to come to that conclusion themselves, because we can try to counsel them all we want. We can try to
Yeah.
tell them what they need to do. And I think we've all had this experience with someone in our lives,
Mhm.
but until they've come to the conclusion themselves, it's not going to go very far. Or if they do make the change, it's not going to last very long.
Yeah, and I think another thing that's really important with that too is that sometimes that is how they cope, and that is what has kept them alive, and so I think about
Mhm.
substance use, sometimes thank God for that, right? Because that has been the thing that has kept them going because there is so much pain that if they were to sit in it without additional coping skills, so, like, to me, I think the ideal thing is that, right, when we're with someone who has these coping skills that are, going to cause some long-term harm and they're interested in shifting it, that we can look at maybe some harm reduction to start, but also what are these other coping skills that we can bring into their life? Because then they can start to use those, they can start to see how, oh, these are helpful too. And you can do like a harm reduction technique.
100%. I think that's a great point and something that I see a lot in street
Mhm.
medicine, right? It can be easy to
Wow.
be like, hey, you're using this, stop using, here are all the resources to like stop
Right.
using and go from, 100 to 0 super quick. But sometimes what we need to do is, like you said, just reduce the harm, maybe put them
Yeah.
on talk about medications that are, if it's opioid use disorder, for example, maybe we can transition to a different kind of opioid that's
Yeah.
indicated for that. Or make, I know harm reduction is restricted based on the areas that we're in and like needle exchange and all that fun stuff. It can be, you know, come under fire depending on the politics of that area. But that's a good example as well as like, hey, we're trying to prevent disease transmission. Of course, we don't want
Yeah.
them to use, but if they're going to continue to use, just taking just not not providing them with maybe a clean way of doing that is just gonna lead to more transmission, right? Because
Yeah.
it's gonna happen whether we want them to or not. But
Yeah.
starting there and what that does too, a lot of people don't realize is it builds the trust. Hey,
Mhm.
this provider, especially for someone who's probably had so much trauma, they haven't had very stable relationships, this person's continuing to show up. They're meeting me where I am. They're not trying to just
Yeah.
change me based on this one behavior. I know this I might even know this behavior is not healthy, and I'm fighting myself to get out of this.
Yeah.
But, all these people are just upset with me. They want me to change too quickly. I can't do that. And so then I just end back up at square one. But if you can
Yeah.
meet them where they are and build that trust, it might be a few weeks, a few months, even a few years. But the
Yeah.
more that you build that trust, the more that you take those baby steps and work on the things that they want to work on and reduce that harm, the more time we give ourselves for them to kind of come around to that decision to, hey, let's maybe now is the time that we try to come off of that. And I think we just can't underestimate the power of building trust with patients and the ones around us.
Yeah, that, like, viewing them as human, right? Seeing
Hmm.
as human. We are all human, and we're gonna make mistakes, and we're gonna have setbacks, and we're gonna struggle, and our struggle is gonna look different than the next person's, but we're all gonna have them. 'Em. We're all gonna have hard times. We're all gonna need coping skills that sometimes are short-term coping skills, right? If we want to stay healthy. So,
Hmm.
I think it takes us back to that idea that we're just all humans showing up together.
Hmm.
And also, I wanna make sure that we have time too to talk about the work that you're doing with chronic pain,
Hmm.
because, again, I feel like we could talk for 10 hours and cover all these really cool talk about so many cool things, but I really think that the work you're doing with chronic pain is so important, and I would love for you to talk a little bit about that, like, what brought you into that area and what you're doing with it now?
Yeah, absolutely. So once I came out of my NP program,
Mhm.
I started seeing, patients on my own. And right, when you're in school and you have these short rotations, you don't necessarily follow them for a prolonged period of time. You're answering the questions on the boards, right? And it's like, okay, they have pain, you give this, whatever.
Yeah.
But then when you're following up with real human beings for a long period of time, and like, okay, yeah, I can put you on this medication for a short period of time, but I can't put you on it for too long. And then all of these come with side
Mhm.
effects. And
Yeah.
okay, I sent the referral to pain management. I sent the referral to physical therapy. I sent the referral to ortho, rheumatology, whatever it might be. And then they're kicked back to me. It might be a few months down the line. There's fragmentation of care. And what it kind of boiled down to is my patients weren't getting better. And I
Yeah.
felt like I was running out of tools. Okay, I guess I can go to this medication, but this is, an antidepressant and might come with different side effects. I can go to this medication, but it's a controlled medication. This person has a history of substance use disorder, right? Do I want to start them on that? Or maybe they don't want to be on that medication in the first place. And I just felt inadequate. I felt hopeless in terms of treating this population. I said, if this is going to be my career, and 24.3% of US adults are living with chronic pain today, a quarter of all US adults. I'm gonna see a whole lot more of this, and I can't feel like this, and I can't see my patients living like this for the rest of
Yeah.
like, there's gotta be something more. There has to be something that we're missing, right? We're in the 21st century here. And so the more I started to do research, the more I started to realize that our understanding of pain is really changing.
Mhm.
And, I could go into all the nuts and bolts of that, but I think it really boils down to the fact that our bodies aren't cars, right? If we have back pain, we're just like, okay, let's check out the back, let's get the imaging, and all of that can be beneficial for sure. It depends on the situation, but we view the body as like a car or a machine that has parts
Mhm.
that need fixing,
Yeah.
when in reality we're completely kind of we're not really looking at the nervous system unless maybe they have neuropathy or shooting pain, right? But we're not looking at the nervous system. We're not looking at the mind body connection, how that might be playing a role as well. And there's been more kind of recognition of something called like nociplastic pain, where the pain, as pain becomes chronic, it kind of becomes a condition in and of itself. It's no longer a symptom like after an injury, where it's more of a symptom of tissue injury and inflammation. It kind of becomes its own disease. Like the tissue healing is done. So
Mm.
then what happened? Why is this pain persisting? And sometimes it just
Yeah.
is getting encoded in our nervous system. Sometimes there is low level inflammation. I don't want to discredit all the peripheral drivers of chronic pain because those do exist. And so what we see sometimes is a pendulum swing a little bit too far, and all we need is nervous system regulation and therapy, and we're going to be all good. And these patients are in 10 out of 10 pain, and that's not going to do any
Right.
good. So
Right.
there's nuance and there's so many different chronic pain conditions. So I just want to throw
Yes.
that out there. But for a lot of chronic pain, I was realizing that the way that we were taught about it in school, the way that the patient is taught about it, how they are able to handle their pain, how they are able to approach it really matters. Because if they think, "Oh, my back is acting up again, there must be some injury going on, so I'm gonna avoid that activity." And now they've gotten into this cycle of, "Hey, I'm fearing this pain.
Yeah.
I'm retreating from the things that I love. Maybe now my mental health is going down the drain. I'm creating this fear around this pain. Now it's encoded in our nervous system a little bit more like, hey, that's dangerous, right? You got to avoid that."
Yeah.
And then we get more pain as a result because now we're more wound up. And then now we fear that more. And so it's this thing called the pain fear cycle where
Mm.
we just things spiral out of control. And now we start avoiding activities, things that we once loved. And now our quality of life goes down the drain. That has a whole impact. And so, anyways, I could go on for forever, but really when we're looking at chronic pain, it's a complex biopsychosocial condition. There's so many different interplays. And the way somebody put it is, pain in our body is really like an ecosystem rather than these parts that need fixing. And so that really got me jazzed up. And I was like, wow, this is such good information. And I really want to bring that out to the public. And so that kind of initially kicked off my journey into chronic pain. And I felt like that understanding plus so much else that we could again talk about on multiple podcast series
Yeah.
um, is I think so important to get out into the public because we know it takes what like I think that the current estimate is like 17 years for research to make it into practice. We don't have that long. We don't have that
Right.
long to get it in. I mean, we don't have 3 years, 5 years to get that into practice. And we have this
Yeah.
wonderful tool of social media where I can get something out today and that might
Yeah.
reach thousands, hundreds of thousands. I mean, I was going to say millions. I haven't quite gotten there yet, but of people from just one video, right? And now we
Right.
up this understanding, but again, then also incorporating some of that communication and listening to the patients. And so then that area of social media, that area of patient care has been awesome too. Cause it's like, where are the gaps and where do they really need healing for us to really
Wow.
continue on with this conversation too? So anyway, that's just I tried to fit it all into one little explanation. I'm sure I'm forgetting things. And again, it needs to come with some nuance here.
Yes.
Because again, it comes down to meeting patients where they are, what their personal preferences are. Um, and there's a lot going on in the pain world today. Medication and regulations and
Yeah.
everything like that that complicates the waters a little bit more. But again, conversation for another time. But that's a little bit about where I came from with this whole chronic pain stuff, and
Wow.
and I'm really, really honored to be a part of the community and to continue to work with these people that are just doing such great work in this space.
Yes, it's amazing. Well, Alec, thank you so much for sharing that. And I know you could talk about it for hours, but what you shared about chronic pain was so important for people to hear and so informative. And Again, I want people to go to your Instagram and TikTok and see what you're sharing about it because you're really, you're validating and showing a lot of compassion for people who are living in chronic pain, and I know that a lot of people in chronic pain have come up against a lot of dismissal, invalidation, a lot of stigma around it, so I think it's beautiful that you're doing that work,
Thank you.
and
Thank you.
yeah, and as we wrap up, I wanted to ask you if there is something that you wanna make sure that this audience takes away from this episode.
Yeah, I think the biggest thing for me is, well, it's twofold, right? I think that, especially speaking to patients who have dealt with medical trauma in their time, right? One, it's not your fault. It can
Mhm,
be made to feel like your fault sometimes. I know medical gaslighting is very real.
mhm,
I think providers aren't trained very well to deal with highly emotional situations, the
yeah,
idea of uncertainty. And so I just want to make sure that you understand, it's not your fault and you might understand that. The second point that I wanna make too is that I really think that I always like to instill a little bit of hope too. I think
yeah,
the tides are turning in healthcare little
mhm,
by little. I think with the pandemic, this conversation around mental health, more conversations like the one we're having today around trauma and
mm,
support is becoming normalized. It's being infused into our providers that are being brought up today. I would
mhm,
say that every student that I have had over the last few years, I would
mhm,
feel comfortable sending my patient to, in terms of they're just so good with wanting to connect with the patient and feeling empathetic, and it's becoming part of the curriculum and it's being part of becoming part of the everyday conversation. And so I'd I'd say just maintain hope. There are providers out there that wanna help you, that
yeah,
wanna care for you. There are great support groups out there, so if you're feeling alone, there are people just like the beautiful space that you created, Sarah,
thank you.
that can kind of help you through that. You don't have to settle for the provider that you're seeing right now if you're feeling like it's just not working for you. You don't feel like they are a supporter of you. You feel like it's draining every time you go there. There are
Mhm,
other providers out there. It might take 2, 3, 4, 5, 6, 7. That
yeah,
can be draining in and of itself. I can
mm,
acknowledge that. And to my people who are in rural towns where you maybe don't have
mm,
all the resources available, I know that's particularly an issue, but I just want to instill a little bit of hope that
yeah,
the conversations are happening. I believe the tides are turning a little bit, and that we will begin to and continue to decrease the incidence of medical trauma as we go along. It's always going to be there in some form or fashion, and it might
yeah.
take a little while, but I just like to instill a little bit of hope and optimism. Maybe it's just the optimist in me, but yeah,
I
that's what I
agree
want
with
to take
you.
away.
I
Mhm.
think that's so beautiful. I think that's so beautiful, and I agree with you. I mean, more people are having these conversations. I'm finding amazing people like you and some of the other clinicians that I've spoken to on the podcast that are doing just such beautiful, compassionate work, just showing up as you used the word authentic earlier. I
Mhm.
love that, right? Showing up as an authentic human. It's beautiful. So thank you so much for the work you're doing, and I was hoping you could let the audience know how they can find you.
Yeah, absolutely. So right now, it's at Alec Bradbury FNP on TikTok, Instagram, like we talked about earlier. I just got on X or Twitter or whatever it's called nowadays. Just kind of the usual social media platforms. That's where I am. And I recently started a newsletter too. So if you go to my link in bio and any of those social media platforms, you can see it right at the top. And get my newsletters that I'm writing. I haven't really written since college, so we're going along, but I'm having a lot of fun with it. It's a great way to kind of be a little bit more personal with the population that we're talking to. So yeah, find me on my socials, send me a DM, a comment. I'm always reading them and getting back to people, and I love interacting with the community. It's really one of my favorite parts of all of this.
That's awesome. Well, I signed up, so I'm getting your newsletter. I'm excited to read it. One came today. And I'll put all of that in the show notes as well. So anybody that's listening and watching, you can find it in the show notes and just click on the link to find Alec. And this has been such a wonderful conversation. My heart feels happy and full, and I'm so thankful to you for the work that you're doing, both in your clinic and out in the world, but also like what you're putting out in the world. Like this really matters. So
Yeah,
thank you.
thank you so much, and I really appreciate you having me on the podcast and to reaching out and for having these conversations and creating a platform where we can talk about this because it is so important. Medical trauma is so relevant today, and
Yeah.
like we said at the beginning, that having that sense of safety and feeling supported and feeling connected, I can't say enough about the importance of that. So thank you so much for creating this beautiful space that you've created.
Yeah. Thank you.
Thank you so much for being here and for caring about bringing more humanity into healthcare. And if this conversation meant something to you, please share it so more people know they're not alone in their medical experiences. You can find resources, education, and our peer support community at medicaltraumasupport.com. And if you enjoyed this episode, please follow, subscribe, and leave a review. It really helps more people find this podcast. Take care of yourself, and I'll see you next time.